Now, live with Governor Asa Hutchinson.
And welcome back, everyone. We're still in the middle of our virtual town hall, Ask Asa. You guys are doing a great job. Thank you so much. I have to compliment you for having Rex Smith come out today and tell everyone during the news conference that you had earlier to just take a deep breath, because mental health is so important. With that said, Sarah Haberfield, she has a question. She's from Austin. She wants to know specifically, how are you and your staff coping with the stress level right now? I just want you to know that we are thinking of all of you, and we realize the tremendous pressure that you're under. We are praying for our leaders and their safety right now. How are you handling this?
Well, first of all, that means a lot. And my staff is working very hard under difficult circumstances. And, you know, I've been through a lot of stressful situations in my life, from post 9/11 environment and homeland security. But this is different. You're a governor, and the decisions you have to make impact people's livelihood. And it also obviously impacts the health. But incredible team. One of the things I'm grateful that we did was have a day of prayer here in the state of Arkansas, and the way people responded to that in their churches and their communities just meant a lot to us. And so that's the kind of thing that encourages my staff. A lot of support there. They're working hard, but we'll get through it. Thank you.
Dr. Smith, we should ask you too, because you're in the thick of things with all of this.
Well, I would say I don't know if anyone who works harder than the governor, so just trying to keep up with him is a little bit of a challenge. But my prayers and thoughts are really with those who are on the front line of this, those who are taking care of patients, family members who are caring for those who are sick, first responders, but also my staff at the Arkansas Department of Health. They've been doing an amazing job, working very hard, trying to shore up our defenses against COVID-19. I think this has brought out the best in everyone, and for that I'm thankful.
And if we can go back to mental health real quick. I mean, talk to the folks at home how important it is that if you are, you know, reaching your stress point, where, you know, you talk to people and they're like, you know, jokingly they'll say, this is like Groundhog Day. I wake up and it's the same thing over and over again. But this can slowly grind away at people, you know, at folks who have to stay home, even folks who are out there every day.
And people who are dealing with their finances and struggling with that.
It's important to reach out. Help is out there.
That's right. Absolutely. Absolutely.
And that's one of the things that we did today, is that there is at our Department of Human Services a toll-free number for mental health services, and so don't just bear the burden alone, but do reach out. And I'm so grateful for so many neighbors that are calling upon another neighbor, and the creativity of it all. That's pretty special.
Yeah.
It is. Well, on the topic of something that affected virtually everyone, man, woman, and child in the state, on Monday you closed school campuses for the rest of the school year. A tough decision without a doubt. Emotionally, everyone involved in that one. But financially, for the state and families who have now have kids at home, I guess you could say that the decision to make that was not easy.
Well, it wasn't easy, because that puts a stress on our healthcare workers that have the children that have to be in a daycare center, or they have to be able to provide somebody else that can take care of them. So it stresses that system. But also, as Secretary Johnny Key says, the school environment sometimes is the safest environment for some of our at-risk kids out there. And so I applaud our teachers and our schools that are providing meals, trying to fill in that gap there. But yeah, that wasn't fun, because you know, we have to go to online education, and they're learning. It's difficult, but they're learning, and that's one of the adjustments we'll have to make, is to really make sure we can have our high-speed internet available in our rural areas, so there's not any gaps there. I hope that next year is a normal school year. This is the last I hope that we have to do this.
Everyone's been asking.
And I have to say real quick, my daughter, who's now doing AMI days, I've got to say it's kind of fun in the morning interacting with her. She goes through her lessons and she asks questions, and we engage in the educational process. So it opens up that benefit. You know, there's interaction with parents and their kids in the learning process.
Indeed. Yeah.
Sticking with education, you waived the state testing requirement. Will students advance to the next grade without having to take that state assessment test?
Yes. and I probably can't get too technical there. The education department will have to address that, but the students are going to graduate this year. The seniors are going to graduate. The students will move on when they complete their AMI. It's alternative method of instruction. They can move on to next year as well. So, we're going to suffer because we don't have that measuring tool in the test, but they will finish this school year and move on to next year.
Okay.
I want to get back to the kids real quick. John and Maumelle sent this question in. What do you say to parents who are now scrambling to find daycare since the schools are closed? And DHS has been working on this.
Well, they have, and that's a very good question because, whenever they talk about shelter in place and closing everything, I had a lot of pressure to close daycare centers. Well, if you close the daycare centers, then where's the healthcare workers going to put their children? Where's the first responders going to put their children? And so it breaks down the whole system, and a lot of them have to close for various reasons anyway, but when the daycare centers socially distanced, they got to put their protective measures in place, but thank goodness that they are willing to continue to take care of children because there's the great need for so many that have to go to work and they don't have any choice about it. So hats off to them, and hope we can expand those opportunities.
Another viewer is asking the question, this stunted year of education is hard for everyone, but harder for those who need specialized education. What measures are being taken to make sure children with IEPS and 504 plans, and of course we're talking about special education here, are getting the attention and the help they need?
That is, Secretary Key says that's one of the hardest things about closing the schools, because you have the special students that need additional assistance and have their IEP plan. That's something that we have to talk with the school superintendents and your teachers to see how that gap can be filled, but there's not a good answer.
Oh, that's too bad. That's
you
tough.
touched on this, and this is a health issue, but nutrition for kids. The schools, they'll continue to provide lunches for kids. I believe they can pick them up. This is a question coming in from one of our viewers.
They can.
They can.
Yes, in the schools, they immediately jumped in there to do that, and we got some special waivers so that we can do that even though the school is not operational. And so they have means to pick up their lunch or other meals that are there, and some other services they can provide. So that's something that we want to make sure that the kids just don't go without simply because we're closing the physical school.
Speaking of kids, what about summer camps? Will summer camps be held in Arkansas this year?
Well, I know that Boys and Girls State, I believe, has been canceled. The Governor's School, these are educational tools. I think that will be postponed. And so I think it depends on when that camp is as to whether we're through this emergency or not. Dr. Smith, what's your thought on that?
I agree. I think it's really early to say. I think based on what we're seeing across the country, it seems unlikely we'll have a lot of summer camps this year, but we can hope for the best but plan for the worst.
You know, the one question I keep hearing, when will we be out of this? At what point is it over? And I know that's a tough question to answer, but I'm asking you so that you can just satisfy our viewers on this.
I'll give the optimistic view on this.
Okay.
And we mentioned that University of Washington study, and it projected that our peak will be April 24th is the last time I checked it. And that's not that far away. And people can see that and say, well, I can make it to there. And that's supposed to be the peak. And then, of course, you've still got recovery. You've got more cases. It's just you're on the downward slope there. And that is unpredictable because we don't know, but that is an optimistic forecast that the University of Washington gave us. Dr. Smith?
Well, looking at our number of new cases have stabilized recently, and so that gives me hope that we'll hit the peak and start to see a decrease in numbers. But it's difficult to know. What I can say is, although we're not certain exactly when it's going to peak or how long it's going to take, I'm confident we will get through this, and we will make the adjustments that we need to make, and the governor will make wise decisions on when to reopen businesses and things of that sort. We'll get through this.
Would you say that now as we stabilize and perhaps we see a downslope, that this is when it gets the toughest? Because this is when you don't want people to fall into a malaise, you don't want them to be overconfident, and you don't want them to think, we're on the downslope, we can go about our business. And that's when the press is really on to stay the course.
Right.
Well, that will be one of the toughest times for us, because at the health department we'll be tracking down every case and doing complete contact investigations. We'll be working really hard to keep the genie in the bottle.
Yeah. You know what? We have just about run out of time, but we want to take this opportunity to really thank both of you
Gentlemen,
for
thank you
being
very
here
much.
and answering so many important questions from our viewers.
Run
Governor,
through the tape.
Dr. Smith,
Don't
thank
let
you very
up.
much.
Let's finish strong.
Will do. So long, everybody. Have a great night and be safe.